I think it's pretty clear at this point in time of the harms of lead exposure. And I think that's one of the reasons USAID became passionate and more involved than ever in this issue, is that you really can't refute the data. What we have been saying is at least 1.5 million lives lost, largely due to early childhood exposure to lead. With upcoming preliminary estimates, we expect that it's at least double that, which it's already at 1.5 above HIV and malaria. So just imagine double that number. So it's not an issue that's going to get better on its own. And so I think, given all the statistics, given USAID's longstanding interest in childhood health and education in the environment, and then helping countries to, have the tools and capacities they need to take on these issues in the long term, this has been a really compelling issue for us as an agency. And UNICEF as well has already been deeply entrenched in this work. Probably 5 years ago, really started to recognize and tackle lead as well. And so we're just so pleased to be working together with UNICEF, but also with many partners who are actually on this call right now. So I can't see you all, but I think and I hope many of the partners who have already joined the Partnership for a Lead-Free Future have joined today. So that's really so thrilling. And actually, it's going to be, our success will hinge on, what everyone brings to the table. That's, I think, the point of this partnership that we launched at the UN General Assembly at the end of September. I think one of the most powerful quotes you might have heard in that video is the president of Malawi, President Chakwera, very astutely saying that there's no faster way to rob a country of its future than poisoning its children. So I think that's really resonated with me and hopefully with you as well. So again, we know that the sources that are largely contributing to childhood exposure can be on the consumer goods side. It can be paint, spices, cookware, all sorts of stuff within the house, but also unsafe industrial processes, which leach into the soil and the air where they live and play. So tackling this range of ongoing sources, which continue to be persistent in low and middle income countries, whereas in places like the United States, it's become unacceptable for those sort of sources for us to live and be exposed to them. So there's just a huge umbrella of an equity issue here. But in low and middle income countries, it's the private sector. I think that's what I want to drive home, is the partnership with the private sector is absolutely key to making impact and to making progress here. And so I think that part of the principles of this Partnership for a Lead-Free Future is to bring private sector together with the researchers, with the donors, with those who really have the evidence base and understanding of exposure pathways and sources, and to be part of the solution together, oftentimes, as demonstrated in the instance of paint, in a way that's actually cost neutral for industry. So we really hope to take some of those successes, some of the kind of quote unquote playbooks that we know are successful, and to continue to roll those out such that children across the world in low and middle income countries can benefit. I think one key point to drive home is that at the launch of the Partnership for a Lead-Free Future, we were able to announce $150 million total to be available to support country-led efforts, but also the development of global tools and innovations. That is 10 times what we estimate to be the kind of average yearly donor contribution to more like 15 million to this cause. So I think that in and of itself is a sea change, and we're so pleased. But we really consider this the floor and not the ceiling, because really to make impact over 5 years, 10 years, to achieve this vision, and actually we could go to the next slide if we're ready, to achieve the vision of the partnership, thank you, for a lead-free future, it's going to be all hands on deck across sectors, and it's going to take concentrated resources. And in some cases, the fixes, the interventions are not actually expensive, but countries need to be able to tackle those themselves, have the tools, the long-term capacities to not only set up regulations, but also enforce them over the long run. You might need expensive technologies like X-ray fluorescence detection devices, which are not cheap right now. So there's all sorts of potential within this partnership in the coming 5 years, in the coming 10 years. Again, it's going to take all of us working together and where possible, those who are on the donor side continuing to figure out ways to contribute to this really critical issue. So I will stop there. We will welcome questions, can offer additional information either during this call or after we're off. But thank you so much. I'll pass it back to you, Walter.
Thank you, Nida. Yeah, we're gonna have a part for questions pretty soon here. But I want to remind everybody, please. I think it might be related to some of the binging, but please put your questions in the Q&A function there. That'll be the best place for us to gather them and get them answered for you. So I want to turn to Latanya. Latanya, I know you've been a big proponent of philanthropy's need to do more big bets, as we saw in the video. I'm hoping you could talk a little bit about that and your vision for this, how the fund can support that work. Think you might be muted.
Most often, you would think we could get that right. But thanks, Walter. And I was saying thanks to Nydia for her remarks as well. I mean, earlier this year when I joined RPA, we came across a fairly remarkable statistic that we know that during the next 2 decades, right, $84 trillion in wealth will pass from one generation to the next. So from the boomers to the X. And this is like the greatest transfer of wealth in our history. So, and more than 70 trillion of that, by the way, will pass before the end of this decade. And, when I was in Nigeria during that opening video, the World Bank was there and they said that approximately 1 trillion of that is coming from Nigeria alone. So countries that would not have seen that kind of wealth before, right? And so the same study estimated that we're probably looking at a little more than 14% of that wealth is going to go towards charitable giving. And so, here at RPA, we're thinking that this is like unprecedented, this transfer of wealth. And it presents us with this extraordinary opportunity to what we're calling place big bets on big solutions to big problems. No more are we sort of in the phase where we're thinking of, philanthropy as charity. We're thinking that it's a finite set of money that only a few people can get. We're talking about a new generation that's going to take charge of this wealth, and they're going to find new ways to serve their missions. And organizations like ours, like at RPA, we have this responsibility to ensure that these funds are directed to the right issues, to the right communities, and the right people. And so this initiative is one of the answers for seizing that opportunity and fulfilling that responsibility. We're looking at these kind of big bets and just sort of laying the groundwork about why this particular fund is important for us. We do think, first of all, that we need to help our partners identify problems, solutions, and the people and organizations best positioned to deliver the change that we're hoping for. And we have to look between these silos, education, health, economic growth, and we need to find the opportunities that might otherwise slip through the cracks. And this is certainly one of them. But second, we need to gather the kind of intelligence, data, insight, and perspective to inform where and how we're going to help courageous change makers that are already doing this work and have been doing it for many years. And then finally, in deep collaboration, we have to drive, deliver, and measure that impact. We have to monitor results, outputs, outcomes, so we can share how we are contributing to a more just and equitable world. And so that's where RPA's head is right now. And this Eliminating Lead Poisoning and Innovation Fund that we're starting is one of the first big bet initiatives. And we're just trying to get started. And so this fund is tackling this, as we talked about, often overlooked lead poisoning crisis head on. Lead exposure continues to pose significant risk, especially in low and middle income countries. And as we said, it's impacting children's, their cognitive development and costing an estimated 1.4 trillion in global GDP each year, which we learned at the launch in September. So this is an important issue of environmental justice and equity, and we have the opportunity to close gaps in health and education that persist between high and low income communities globally. And by directing our attention and resources, we're making a bold statement, right? No one should suffer from lead poisoning in 2024, honestly. And translating this mission into real changes on the ground means that our fund will support the advancement of accessible, low-cost solutions to detect lead in people, the environment, food supplies, and other avenues of exposure in communities that are still affected. And currently, reliable testing tools are often confined to research labs where they're like prohibitive and expensive and inaccessible to most of the communities that we're talking about. And that's why we feel like our fund will prioritize advancing affordable portable tools to measure not just blood lead levels, but also environmental contamination in a way that actually empowers communities directly to get it in their hands and to take action. And we also know that some of the most transformative ideas come from those unexpected and often underexplored places. And our fund will launch this Innovation Prize program to support breakthroughs that may have previously been just unrecognized, I'll say. And at RPA, we've guided others in building prize competitions that prioritize equitable access and impactful results. And now we're building this one ourselves to identify and support the best new ideas that are out there for detecting and managing lead exposure. So innovation isn't just technological, right? It's also the way we engage with the communities that are directly affected. And that's why the fund will establish an expert advisory board with representation from frontline communities who bring lived experience and local knowledge to the table. And by involving these voices in decision makings, we can ensure our interventions actually reflect their needs and their wisdom, and that it's more than solving a technology problem. It's about transforming lives in a way that truly resonates and supports communities. And so when we look at the global partnerships that are forming around lead elimination, we are inspired. We're proud to collaborate with this particular partnership for a lead-free future. It's a coalition that brings together governments, as we said, public and private sectors, other philanthropic partners to achieve a common goal. And quite frankly, that's the way we're going to have to move in the world that we live in. And this approach to lead elimination underscores our broader vision at RPA for big bets. We'll continue to identify pressing global issues, we'll gather the intelligence to inform solutions, and we'll convene our network to drive this lasting impact. Thanks, Walter. So back over to you.
Thank you very much for that vision, LaTonya. So I want to turn to Brett now. Brett, I know you work around the world globally to eradicate lead poisoning. I was wondering if you could talk about a case study that you had mentioned to the rest of our audience.
Yeah. So I'm going to talk about the Republic of Georgia. And for folks, you likely don't know, you may not know where it is. It's a small country of about 3.5 million people in the Caucasus region of Europe. It's relatively geographically isolated by mountains. So it sits in the middle of the Caucasus Mountains. And it's bordered to the north by Russia and to the south by Azerbaijan, Armenia, and Turkey. And below those countries is Iran. So it's really sort of the southeastern corner of Europe. Beginning about a decade ago, American and Georgian researchers started looking at blood lead levels in and around the capital of Tbilisi. And those studies found sort of really high levels. 30% of children evaluated had blood leads of above levels of concern, 30%. So for context, around that time in the US, the level was like 2% of kids. So they were pretty high. One of UNICEF's flagship programs is something called the MICS, the MICS, the Multiple Indicator Cluster Survey. And at its core, the MICS is this questionnaire on various health and nutrition questions. So things like iodized salt, whether or not a family has migrated recently, so on and so forth. But based on the data that were coming out, the idea came around to include blood lead surveys as part of the mix. And this had never been done before. This was unprecedented. And so a phlebotomist accompanied the mix team around while they were doing the questionnaire. And so they visited the homes of more than 1,500 kids. They collected blood samples and they sent them to Italy for analysis. And you should be aware, I mean, I should pause and say that at this point, this sort of effort was unprecedented. There's a handful of countries around the world that do blood lead level sampling. So the US does it really well. A couple of countries in Europe do it really well. But for a low or middle income country to do nationally representative blood lead level measurements, particularly using this method, this laboratory method, it was really it was new ground. So the data that came back were, so if you recall, there were 30% of kids in the earlier studies that had blood leads of above levels of concern. These results were now showing 41% of kids had blood lead levels above levels of concern. And perhaps most worryingly, there was no indication of what might have been causing it. So what were the sources of lead exposure? Lead exposure, particularly at that stage of development, so like age 1 to 5, lead gets taken up by the body as calcium. It works its way to the brain and it interferes with brain development. So lead exposed kids, all things being equal, have lower IQs than their non-lead exposed counterparts, excuse me. And we can quantify that economically. So we know, for instance, that one IQ point results in a loss of lifetime earnings of something like 2%. The World Bank took the data from Georgia in the year 2019, and they calculated $200 million in productivity losses attributable to those lead exposures. So really a large economic impact, in addition to all the adverse social and health outcomes. So a lot of countries around the world know they have high blood lead levels, even if they haven't done these surveys. And they know the sources of exposure, whether it's kids living next to a lead smelter or whether it's lead-based paint flaking inside of a home. But what makes Georgia really stand out is that it took immediate and sort of comprehensive action on lead poisoning. It did follow-up visits with lead poisoned kids. So some kids that had high levels of lead ended up getting sampled like 3 or 4 times. It formed a state environmental health program that trained pediatricians in early detection and management of lead exposure. And it contracted a US NGO based in New York called Pure Earth to go around and do source identification work. And that work resulted in the identification of a really unique source of lead poisoning. It turned out that lead chromate, this sort of bright yellow powder, which is essentially poison, was being added to spices across the Republic of Georgia. So the government took this information, they tightened enforcement, they tightened monitoring, and really within a span of like 2 years, you see exceptionally high lead levels in spices in the year 2020 to basically nil in the year 2022. So owing to all of this work, so to the pediatric blood sampling, to the training of pediatricians, rather, to the tightening of regulation, to the identification of sources, we saw precipitous declines in blood lead levels. Within that first year, by the end of 2019, we saw declines of up to 30% across the country on average. The blood lead information for kids more recently is not yet publicly available, but what I can say is that a recent study of pregnant women found a 60% decline in blood leads from 2020 to 2023. And just to give you context, I mean, I personally am unaware of that sort of decline at national levels outside of the removal of lead from petrol in the United States in the 70s and 80s. It's just this unparalleled success, if I'm being honest, with regard to lead exposure. So UNICEF was there the whole time providing technical assistance. So we helped with the procurement of 4 handheld XRF analyzers. I'm sure we'll talk about what these are, and some lab equipment. We supported the University of the Arctic in Norway to develop this surveillance system. And all told, we spent something like $1 million, I think, in the lead exposure program in Georgia. So really, obviously, just this huge return on investment. And just to highlight, several factors really contributed to the success here. So the first is this closing of the data gap. So we supported this mixed study, and we bought some lab equipment to get really good data on lead poisoning, where it was, how to target it. And then there's this whole of government approach adopted by the Georgian government. So you have the regulators working with health, with environment, really cracking down on lead exposure. So it's a success story, and we're working to replicate it. So we're doing this work in mixed studies throughout Asia and various African countries. And And I'll finish by directing you to our website, the Children's Environmental Health Collaborative. So there's a lot of materials available on the website, including this case study, so you can read more about it if you're interested, as well as a free e-course on environmental health. Thank you.
Thank you very much, Brett. That's a great example of what can be accomplished through this kind of work. It leads us to another question we have was what existing innovations or technologies are available, and where are we seeing gaps in terms of trying to create other case stories just like that. I wonder if we could begin with you, Nida.
Thanks. Yeah, I mean, I think that, so there's what we know, and then there's probably what we don't know. So kind of back to LaTanya's call for breakthroughs. So what we know is that in terms of measurement, we need to be able to measure the blood lead levels. We also need to ideally pair that with measuring the amount of lead in sources that are likely contributing to those blood lead levels. On the blood side, as Brett said, MIX through UNICEF's program has been doing this effectively. It's a venous blood draw. It's not a simple, fast, uninvolved process, right? But however, MIX is there and supports other biometric indicators in a lot of countries. So it's kind of a known and trusted survey system. We at USAID have something called the Demographic and Health Survey. Similarly, in other countries, usually where there's not MIX, like some similar information. To date, the DHS has not supported blood lead level testing. We are hoping, and partly because of this partnership, have rallied kind of support and momentum for this, to be able to build that into our DHS. So that can also be, of course, per the demand of the country, available if they want to add that to their survey. But I think, so there's the venous approach, and then there's a point of care capillary blood draw approach, which I think still requires additional research into making sure it's as efficacious as possible. So I think that's one big area for additional innovation and research is, making sure that the point of care capillary draw approach is getting you the best information possible, but also that the machines that you can bring out into the community are affordable, not just for donors and NGOs to be bringing out and then taking away, but for the actual host country government to be able to employ themselves. So I think that's one big technological opportunity. And on the other side is this portable XRF machine, which I think we've all talked about a couple of times, is critical. It's probably too expensive to take to scale right now. And it's also, I think, refining the calibration and its efficacy in measuring amounts of lead, et cetera, in all sources. That's another big opportunity. So I'll stop there and let others come in. Thanks.
Thank you very much for that. Brett, did you have some thoughts on some of the technologies or other approaches from your perspective?
Yeah, I mean, with regard to blood lead testing, Nida mentioned there's this capillary system. There's basically one unit on the market right now that does that. And it's been used in various countries. So it was recently used in Bhutan. It's been used in Mexico to do these blood lead surveys, and it's rapid and it's cheap. And it's a point of care instrument. So it's a pretty powerful tool in that way. In this study, in the Georgia's case study, we used this. We actually had to have a phlebotomist on site to do these blood draws, and then we sent them to a lab. And as Nida pointed out, that's involved. There's sort of a compromise right now. There's this new technology called VAMS, volumetric absorptive microsampling, which is showing a lot of promise. There's people XRFing, taking these instruments out to the field and shooting bones to identify how much lead is in the bone. There's things like blood spot assessment. So there's a whole bunch of new technologies that have come out in the last couple of years that show a lot of promise on the biological side. On the environmental side, we're just very reliant on the XRF. It does a whole host of solid media. It does not do water. It would be good to have something to analyze water out in the environment. Water is not often a major source of lead exposure, but it's really important to assess and have a high quality instrument to assess it. And then it would be good to have, as Nida pointed out, the XRFs are expensive. So there's other kits that we can use to do sampling, but many of them are qualitative rather than quantitative in nature. So it would be good to have some improved instrumentation there.
Thank you very much. Latanya, I'm hoping you can talk a little bit maybe about how philanthropy might step into this space here with some of these approaches that make a difference.
Yeah, thanks, Walter. And just to go back a little bit to what Brett and Nada was saying, and also what I saw in the questions, because I kind of took a peek at it, the distinction between the US and other high incidence areas around the globe. There is, I think Brett was alluding to, there is another coalition similar, but lead in water. So a lot of donors have come together around that, governments and others. And so there is a very specific look at that. And I think, and maybe Brett, you might know better, but in the US, that tends to be where some of the incidents are happening around lead and water. I mean, we've seen the cases in Flint and other places. And so this, though, I think in this sort of collaborative is trying to focus on really high incidence areas where we're still seeing an unacceptable level. I guess any level is unacceptable, but where we're seeing that the numbers are incredibly high, both for lead in blood for children, but also in pregnant women. That is where I think this fund is really trying to target, and certainly for RPA, when we're thinking about innovation and again, innovation not just as technology, but trying to change some of these issues and how we test in the environment. We are thinking about those solutions coming from those areas where the incidence is the most high, and that is global. And the study itself does have some priorities, which I think we can talk about in the Q&A. But I think that one question alluded to our political situation, like the de-emphasis or the emphasis on climate, and will that change the way we look at that? It certainly will not for RPA, and I can almost guarantee, I don't know if Brett knows this, but I spent about a decade at UNICEF, and Anita, I spent more than a decade at USAID. So I know how these things work, and I've worked for, Democratic and Republican administrations, and that won't stop what we're trying to do here. It won't put a halt on what this work is. And of course, everything I said about really identifying where the gaps are. I do think, and I'll bring this up, philanthropy has a unique and critical role, despite what administration is in office in any of our countries. But I also want to remind people, because I just saw this on Hulu, for those of you from the US might remember her name was Erin Brockovich. And I like to call her a badass everyday feminist. So that's a plug for my book. But she's an environmentalist and now attorney, but she spent decades trying to work on environmental issues in her community in the US. And I think those kind of people are everywhere. People who have been doing this work and slogging through it. So it's not like, because it has become a priority of a particular administration in whichever country that people are going to work towards eliminating lead poison. It's because it has to be done. It is like killing children. You've heard all of the statistics. And so it is not the politics that got us here. And it's not the politics that's going to get us out of it. It is the work that we need to do together to make sure we're addressing this issue so we can save the lives of children and certainly get the blood levels lower for pregnant women. So all of that, I just wanted to, just remind people that this is not a political issue. This is a crisis that affects millions, and it lacks the visibility and investment it deserves. And I think philanthropy can step in where others, including governments, venture capital, private equity, can't or just won't. And we can do that by fueling the innovation and supporting the solutions that go beyond, as I was saying, the status quo. And we're here to fund the game changers, right? So breakthrough technologies. Traditionally, we've been doing that. Product development, research and development, and other kind of bold initiatives that tackle lead exposure should be a part of what we're seeing as a game changer. And that's where philanthropy can really shine. And we've got to embrace this bold, innovative approach as if it's going to make real change, because that's what does make real change happen. So not dropping pennies, but, really sort of investing heavily over the next few years so we can get to a catalytic impact. And it's not just about dollars, as we know, but that's going to certainly start helping us set the stage for this change. And it sparks a new wave of new approaches that uplift voices from communities that, as I said before, are the most affected. So, Walter, that's my thought.
Those are some good thoughts. So I want to turn to maybe Nida and Brett, like for your thinking, because we're starting to get into the answering questions here, which are really good and they're coming in. So we're grateful for that. Maybe a little bit about how you think about prioritizing, sort of say which countries, including the US or not, that kind of work. 'Cause I know we have in the questions even now some allusions to that.
Brett, I can jump in and then please, so I can't wade through all the questions. But yeah, so I think I was going to say, kind of on the heels of LaTanya's really good comments, is that, it's not just an issue. We care profoundly about the fact that it's 1 in 2 children in low and middle income countries being most affected. But this is also a problem for the states. When there is, cinnamon detected to have overly high levels of lead in it, it's largely coming from other countries. The spices so the lead chromate poison, essentially adulterating spices in Georgia, those have come, degrees of those, kind of adulterated spices have come to the States. Luckily, we have really robust systems that pretty quickly detect them, alert the public, such that as a parent, I can say, actually, no, I'm not going to give my 2-year-old that applesauce pouch, right? But it's just to note that this is an American issue as well. I think from the USAID standpoint, we have a global mandate, so we really care about that. But this affects us all. So I think there's that. In terms of prioritizing countries, there are lots of ways to look at it. But I think because we have this really robust data, sometimes it's estimates, but through the work of UNICEF and others where they've actually sampled, we have a really good understanding of which countries really have the highest lead burden, as in the greatest kind of number of kids being exposed, essentially. So if you're working from a kind of greatest need standpoint, it's actually pretty clear. You can kind of rank the countries. You need to take into account this kind of likelihood, tractability of the issue, likelihood of succeeding there. So that's a little more complex, right? Are they having a civil war right now? So that might, even if they have high burden, maybe we start somewhere else. So from the USAID's perspective, and we have a long history of kind of working actually even in countries that have crises, we have a good footprint. But I think part of this partnership, the work of this partnership, and it's just, it's in its kind of formation stage still, is to come together, especially with donors, and decide, okay, let's agree on a general way of understanding which are the kind of the highest priority countries in terms of need, potential to address the issue. And let's make sure we're being really intentional about coordinating our investments such that not everybody is doing kind of piecemeal in one country, but we're understanding soup to nuts. What are the issues and the needs in a country, and how can we come together in a really kind of synergistic, collaborative way to mostly support the government to tackle the problem, right? It's not to have us come swoop in and do it, but it's actually how can we support a government, all the tools, et cetera, that they need to really set themselves on a better trajectory. I'll stop there. Brett, please add anything.
I'll come in. In furious agreement with the political will. I mean, there's so many countries around the world have lead poisoning issues. And I think a lot of them have difficulty identifying just sort of initial steps on how to get forward to address them. I think in Georgia, there like I say, there was just this whole of government approach that really was unprecedented. With regard to prioritizing the countries based on what we know about blood leads, I'd say we have reasonably good data. So we have IHME produces this like estimated blood lead levels for many countries, or for all countries. But sometimes we find just those data could be improved. So like in Georgia, for instance, if we look at the data that preceded the blood lead survey, the estimated blood lead for Georgia ended up being half of what it actually was. The estimated blood lead, we just got the data for Bhutan, where 76% of the kids are above 3.5 micrograms per deciliter. The estimated data before that survey was significantly lower. So sometimes we really just don't know that that kids have elevated blood leads in a given country. And moreover, we just don't know the sources. So I think a lot more of this sort of mix, or this, if we were to include integrate blood lead testing in the DHS surveys, it would be a really powerful tool to identify where the lead poisoning is happening and those sort of key sources.
Thank you very much for that. I'm not sure who can answer this question because I'm not sure that I understand a component of it, but I'll put it out to the group. In addition to the Innovation Prize and expert panel, are there other strategies you want to pursue? For example, exploring advanced market commitments and other market shaping strategies. I mean, I kind of sense that, but I'm not sure how it might apply here.
So yeah, I mean, I think so. That's the sort of kind of innovative financing breakthroughs that we're also looking for. It kind of depend on what you're talking about, right? Is it about a technology that you want to apply that approach to, or something else? But that's exactly kind of the sort of thinking that's a little bit out of the mold to date, that at least from the partnership writ large, but I also understand from RPA's Innovation Fund that you're really looking to receive and consider as you kind of structure the prizes. So I don't know, Latanya, if you have anything more there. I don't want to speak for you all, but that's definitely what we want to be considering. Yeah.
Yeah, absolutely. And I think, sort of, we're hoping to get like private equity and the attention of some of these more formal kind of outfits to get involved, especially around our innovation fund, because we know that the prize is one thing, but getting people to market and developing is a whole other thing, right? So there's that piece. And so we do want to create partnerships that help with that. I think, if the same person who asked the question for the fund specifically for this innovation part of it, because remember, it's a much larger partnership and many people are doing different things. We haven't even really talked about sort of what the governments themselves really are doing. And so we want to make sure that you understand that this is just a piece of where we see a need, and that it's been identified that we can specifically address. And we're calling on philanthropy to work with us to do that, right? And so it is spurring innovation in the source identification. We think that might be, and maybe Brett can answer some questions, because I think there's work going on the blood testing part, where we see this huge need is around the source identification. So we do want to lean in there. We haven't made like specific decisions. The assumption is when we do these kind of prizes that yes, we will take US ideas, of course, from people who are here in the US. We do want to lean into also getting ideas from the countries where, the burden is high, because sometimes that's missed in these kind of prizes. And so I don't think it's a like US or not. I mean, we think that it'll come from both. And the hope is that even people who come from those spaces that are now in R&D labs or in universities, who, in the US would also be helpful in trying to come up with these new solutions. So I think, some of the question, it's not so easy to answer, because as RPA, and this is traditionally how RPA works, as it creates these funds, we work together with the parts of philanthropy who comes in. So we don't just dictate how it's going to go. We work in partnership and we determine the best way to move forward based on who joins the partnership. And so for us, it's a rallying call around the power of philanthropy and how we come together to create something, hopefully an amazing prize that will get so many people involved. And it's not sort of your traditional, what you might consider development, you put in a proposal and we grant type of thing. We're trying to say that we need different solutions right now for a problem that's solvable in a short period of time. Does that help, Walter?
That very helpful. Thank you. And I have other questions. I do want to say, somebody asked about conflict of interest in terms of funding. We don't have those conflicts of interest right now. We're always very alert to that as an organization. So that will be part of the criteria that we would develop and assess while we work with donors, to the degree that Latanya mentions too. And then I have a question that's kind of specific, but it'd be nice to hear from the panel. What do you think it takes to get the political will to do lead testing in with a low cost technology accessible to everybody? For example, there was another question was around Nigeria, and then they see the prevalence of lead poisoning. They don't know that, but they see heavy lead and other heavy materials poisoning areas with illegal mining. So there's just different dynamics that are at work that involve government a lot. So I was wondering if the panel could talk about that a bit.
Brett should kick this off. Yeah.
I was going to suggest you should kick it off. No, I think, well, I mean, in Nigeria is an extreme case. For folks that don't know, in northern Nigeria, in the Zamfara region, about 10, 15 years ago, there was one of the world's worst sort of outbreaks of lead poisoning, in which more than 1,000 children died of acute lead poisoning, and that issue is persistent. That triggered a massive investment by the Nigerian government to begin to address lead poisoning, but it is persistent across the country. So in addition to the mining issues in the north, there's battery processing issues, there's lead-based paint that's common. So there's a lot of different sources. I think one of the things that has gotten traction with governments is, and also, I mean, just this is a relatively new issue for many countries, right? So in the US, I think we talk about this commonly. We see it in the news a lot. We talk about Flint. We sort of know about this issue, but in many countries, lead poisoning, particularly in the context of myriad other issues, is just, infectious disease and others, it just doesn't really surface. I think one of the things we've talked about more recently is talking to ministries of finance about the real economic consequences of lead exposure. Neurological decrement does result in decreased economic productivity that's quantifiable. I think these studies and others have had an effect in sort of getting governments more interested. But the other thing is just, in addition to analytical capacity, it's building the human resource capacity to go out and do this stuff, to look for lead in the environment, to train pediatricians in how to identify lead exposure and how to lower blood lead levels. So all of those components sort of supporting governments while, not just raising the issue and walking away, but supporting governments to address it, I think has been really effective.
And I'll just add, I think another key kind of example that we've seen, we keep saying it needs to be multi-sectoral across sectors. So when in countries where ministries do start to collaborate, and maybe they appoint kind of a lead coordinator who can bring the ministries together, and then actually help develop some sort of strategic plan that cuts across all of the sectors. I think that's where we see a lot of progress. When it's just a health problem, or it's just the Ministry of Environment, and the kind of buck can get passed around, right? But what we see is when there is just the start, which shouldn't cost that much money, just a convening. And actually USAID has, with huge thanks to our mission colleagues, when we kind of made a call to action without any funding, that's one of the first things that they could do is say, hey, we have connections through our mission offices with all these ministries. Let's just have a convening where we start to talk about the problem. We start to talk about how to cooperate. And even that actually can have huge impact and can start kind of a snowball effect that can really lead. Of course, there are resource inputs that are needed along the way, but just getting the conversation going in a coordinated way has a lot of power. So we've seen that in Ethiopia and actually in Nigeria as well. And then the other thing is that we've actually seen is this partnership. So when you say we're going to launch this partnership, and once it's up and running, it's going to have countries will be able to benefit from this partnership, whether it is funding to support specific activities or just access to all of the resources, the best evidence that they might need. That has been really motivating for countries, and some countries that first joined the PLF, the before we even launched, were countries that you wouldn't have thought really had lead on their radar. But just the notion through our mission saying, hey, we're going to launch this partnership. We really want it to be heavily based in our country partners. This is not just a global North thing. Are you willing to join? It's kind of broad strokes. These are the mandates. And we had countries saying yes and joining. And so I think now it's the work is to make sure that we're doing, the best service to these countries that we possibly can and equipping them to address this problem.
Thank you very much. we have still a lot of questions left. We're going to have to, because of time constraints, sort of reserve those till we can try to answer them after the call in some capacity, maybe with follow-ups, maybe with emails, that kind of thing. But I do want to give at least all the panelists, a chance to sort of give some closing remarks or a call to action or any kind of thoughts you may have on how we can remain sustained to this commitment. Do we want to start with Brett?
Sure. So I should say, yeah, I've been working lead exposure for like 15 years or something in low and middle income countries. This launch of the PLF, this stuff happening in RPA, there's other organizations, CGD and others. It's an exciting time to be working in lead exposure. I feel like a lot of organizations are coming together and beginning to make a difference. There's more data now on lead poisoning, particularly in low and middle income countries, than ever. So it is, I think it's a real opportunity now. I mean, we talk about ending childhood lead poisoning by 2040, and that does not seem like an impossible goal considering all the momentum and excitement right now. Thank you.
Naida, I was hoping you could give your thoughts.
Yeah, I think my favorite person to quote apparently is President Che Guevara. The other note that he made was that, we collectively, the donor community put so much money into early childhood education more broadly. Yet if you're doing that and not addressing this kind of foundational problem, I mean, that just seems not strategic. So I think, again, for an agency like USAID that has longstanding and will continue to invest in these really critical areas, health, education, and environment, this is just such a no-brainer. Back to kind of an earlier concern, this issue has bipartisan support. The House and the Senate both passed resolutions asking for agencies that are, implement international aid, et cetera, wherever possible to address lead exposure, to help move the dial in lead exposure. So our hope is that continues. This should not be a controversial issue. A company that's literally putting poison into spices so that they can sell more of it, that's not a partisan issue. That's just a clear issue. That's actually a criminal issue. Let's get the tools that we need to understand where that's happening. Let's help governments figure out ways to, regulate and enforce that. And as Brett said, because some areas, there are some mining, et cetera, it gets a little more complicated, but there are some areas where it really isn't expensive and it's doable. And it's not out of the question that in consumer goods by 2040, the world has come together to make sure that the private sector is doing what they should. So I'm optimistic, and I just want to say, so appreciative for people joining today and for what RPA is doing as a big partner.
Thank you very much, Naida. It's great to be partnered. LaTanya.
Yeah, no, thank you. This has been very, really, I am so happy to see people in the question and answers that are already working on this, that they're ready to kind of put their ideas out in front of the Innovation Fund. So keep doing what you're doing. We are not there yet. We are just now kind of getting mobilized. We're bringing in partners in philanthropy. We have not done a call yet. We have not determined an amount yet. We are thinking about a fund of around $10 million to do this prize, and how that looks. We still have to figure it out. But what we do know is, this is critical, as my colleagues were saying, not just for us and our children, but for the future. And really the Eliminating Lead Poisoning Innovation Fund embodies that. And it takes into account the power of philanthropy at its best, being courageous, innovative and unwavering in what is its commitment to change. So we're here to stand really with the communities like yours who are inspired to join this mission, who are already thinking about this. As my colleague said, I've been in a couple of countries now where when you bring this up, whether it's to government, to philanthropy, and or some really incredible community groups, they just don't know. They didn't know the extent of it, and certainly didn't know the possibility of being able to tackle it. And so we need all hands on deck, honestly, to run through this finish line and end lead poisoning for everyone. And it's time to start breaking through those barriers and to take these bold actions and ensure that our impact is felt for generations to come. And that's what we wanted to say today. We will, and I hope my colleagues will be able to email you not just the link to the webinar, but also the site where we can provide you with more information that you can keep checking. So when the prize is announced, that you'll be able to have all of the specific information. But for now, we just wanted to join forces to be together with you. There you go. To join forces with you to be able to really accomplish this together. And I want to thank both, of course, USAID always, and UNICEF for really taking the leadership here. And we are really, really proud again to be able to work together with you to get here. Thanks, Walter.